Breast cancer unveiled, a comprehensive exploration. Breast cancer stands as a formidable adversary in the realm of oncology, posing significant challenges to both patients and healthcare professionals. This comprehensive guide aims to shed light on various aspects of breast cancer, delving into its causes, risk factors, symptoms, diagnostic methods, prevention strategies, and treatment options. By exploring the intricacies of this disease, we hope to empower individuals with knowledge that may contribute to early detection and improved outcomes. Understanding breast cancer. Introduction to breast anatomy. The breast is a complex and dynamic organ that plays a crucial role in both reproductive and overall systemic health. Understanding its anatomy is fundamental in appreciating the intricate structures that contribute to its function and susceptibility to diseases, including breast cancer. Glandular tissue. The breast is primarily composed of glandular tissue, which includes lobes and lobules. Lobules are small milk-producing glands, and multiple lobules form a lobe. During pregnancy and lactation, these lobules become more active, producing milk to nourish an infant. Milk ducts. Running through the breast are milk ducts, thin tubes that carry milk from the lobules to the nipple. The ducts play a vital role in the transportation of milk during breastfeeding. Changes or abnormalities in these ducts can be significant indicators during breast examinations. Connective tissue. Supporting the glandular tissue is connective tissue, providing structural integrity to the breast. It also contains blood vessels, lymphatic vessels, and nerves, facilitating communication with other parts of the body. Fat tissue. Adipose or fat tissue is interspersed throughout the breast, giving it shape and providing insulation. The distribution of fat contributes to the variations in breast size and density among individuals. Lobes and Cooper's ligaments. The breast is organized into lobes, and each lobe consists of lobules, ducts, and surrounding tissue. Cooper's ligaments, fibrous bands within the breast, provide additional support and help maintain its structural integrity. Blood and lymphatic vessels. Rich vascularity, including blood vessels and lymphatic vessels, ensures a continuous supply of nutrients and oxygen to the breast tissue. The lymphatic system plays a crucial role in immune function and fluid balance. Breast cancer types. Breast cancer is a heterogeneous disease with various subtypes, each characterized by distinct features, behaviors, and therapeutic implications. Understanding these types is crucial for tailoring treatment strategies and predicting prognosis. The two primary categories are ductal carcinoma in situ, DCIS, and invasive breast cancer. Ductal carcinoma in situ, DCIS, CIS is a non-invasive form of breast cancer, where abnormal cells are found in the lining of a breast duct but have not spread outside the duct. Often detected through mammography, CIS represents an early stage of breast cancer, and successful treatment can prevent its progression to invasive cancer. Invasive breast cancer. Invasive breast cancer, or infiltrating breast cancer, is a more advanced stage, where abnormal cells breach the ducts or lobules and invade surrounding breast tissues. This category includes several subtypes, each with unique characteristics. Ductal carcinoma invasive, IDC. IDC is the most common type of invasive breast cancer, originating in the cells lining the breast ducts. It has the potential to spread to nearby lymph nodes and other parts of the body if not detected and treated early. Lobular carcinoma invasive, ILC. ILC begins in the lobules of the breast and can spread to nearby tissues. It may not form a distinct lump, making it challenging to detect through physical examination. ILC tends to infiltrate breast tissues more diffusely. Inflammatory breast cancer, IBC. IBC is a rare but aggressive form characterized by redness, swelling, and warmth in the breast. It often lacks a well-defined lump and is diagnosed based on clinical and pathological findings. IBC requires prompt and intensive treatment. Triple-negative breast cancer, TNBC. TNBC lacks estrogen receptors, progesterone receptors, and HER2/NOI amplification. It tends to be more aggressive and may require different treatment approaches, as hormonal therapies and targeted therapies are less effective. HER2-positive breast cancer. HER2-positive breast cancers overexpress the HER2/NOI protein, promoting aggressive growth. Targeted therapies, such as Herceptin, are effective in treating this subtype. Hormone receptor-positive breast cancer. Hormone receptor-positive cancers are fueled by estrogen and/or progesterone. Targeting these hormones through hormone therapy is a key component of treatment. Metastatic breast cancer. In some cases, breast cancer may metastasize to distant organs, leading to metastatic breast cancer. This advanced stage requires ongoing treatment to manage symptoms and control the spread of the disease. Genetic and hormonal influences. Breast cancer, a multifaceted disease, is influenced by a combination of genetic and hormonal factors. Understanding these influences is crucial for both risk assessment and tailoring effective prevention and treatment strategies. Genetic factors. BRCA1 and BRCA2 mutations. The most well-known genetic risk factors for breast cancer are mutations in the BRCA1 and BRCA2 genes. Individuals carrying these mutations have a significantly higher risk of developing breast and ovarian cancers. Genetic testing can identify these mutations, enabling proactive risk management and screening. Other genetic syndromes. Beyond BRCA mutations, several other genetic syndromes contribute to an increased risk of breast cancer. These include Li-Fraumeni syndrome, Cowden syndrome, and Peutz-Jeghers syndrome. Genetic counseling and testing help identify individuals at risk due to these syndromes. Hormonal influences. Estrogen and progesterone receptors. The majority of breast cancers are hormone receptor positive, meaning they have receptors for estrogen, progesterone, or both. These receptors fuel the growth of cancer cells. Hormone receptor status is a critical factor in treatment decisions, with hormone therapy targeting these receptors to impede cancer growth. Early menstruation and late menopause. Prolonged exposure to estrogen, such as starting menstruation at an early age, or experiencing late menopause, increases the cumulative exposure to reproductive hormones. This prolonged exposure is associated with an elevated risk of developing hormone receptor-positive breast cancers. Postmenopausal hormone therapy. The use of hormone replacement therapy, HRT, after menopause, particularly with estrogen and progesterone, has been linked to an increased risk of breast cancer. The risks and benefits of HRT should be carefully evaluated based on an individual's health history and other risk factors. Pregnancy and breastfeeding. Early and more frequent pregnancies, as well as extended periods of breastfeeding, have a protective effect against breast cancer. These life events reduce the cumulative exposure to estrogen and progesterone. Oral contraceptives. The use of oral contraceptives, commonly known as birth control pills, slightly increases the risk of breast cancer. However, this risk diminishes after discontinuation, and the overall impact on breast cancer risk is considered modest. Obesity and hormonal changes. Obesity is associated with higher estrogen levels, particularly in postmenopausal women. Elevated estrogen levels contribute to the development of hormone receptor-positive breast cancers. Maintaining a healthy weight is, therefore, a key factor in reducing hormonal influences on breast cancer risk. Recognizing breast cancer risk factors. Age and gender. Advancing age is a significant risk factor, with the majority of breast cancer cases diagnosed in women over 50. While breast cancer is less common in men, gender does not eliminate the risk entirely. Family history and genetics. Individuals with a family history of breast cancer, especially among first-degree relatives, face an increased risk. Genetic mutations, if present, can be identified through testing. Hormone replacement therapy, HRT, and reproductive factors. Prolonged use of hormone replacement therapy and certain reproductive factors, such as early menstruation or late menopause, can influence breast cancer risk. Radiation exposure. Previous exposure to chest radiation, particularly during adolescence, increases the likelihood of developing breast cancer later in life. Lifestyle factors. Unhealthy lifestyle choices, including excessive alcohol consumption, smoking, and lack of physical activity, contribute to an elevated risk of breast cancer. Early detection and diagnosis. Early detection is a cornerstone in the effective management of breast cancer, significantly impacting treatment outcomes and overall prognosis. Regular screenings, self-examinations, and advanced diagnostic techniques play pivotal roles in identifying breast cancer at its earliest and most treatable stages. Clinical breast examinations. Regular clinical breast examinations by healthcare professionals are essential components of early detection. During these exams, healthcare providers palpate the breasts, checking for any abnormalities, lumps, or changes in texture. Clinical exams provide a valuable baseline for individual breast health. Breast self-examinations, BSE. Breast self-examinations empower individuals to actively participate in their breast health. Regular BSE allows for the familiarization with one's own breast tissue, making it easier to detect changes such as lumps, swelling, or skin abnormalities. While BSE is not a standalone diagnostic tool, it complements other screening methods. Mammography. Mammography is a widely used and effective screening tool for detecting breast cancer in its early stages. This low-dose X-ray imaging technique captures detailed images of the breast tissue, helping identify abnormalities, including masses or microcalcifications. Regular mammograms are recommended, particularly for women aged 40 and older. Breast ultrasound. Breast ultrasound is commonly used as a complementary tool to mammography, especially in cases where additional imaging is needed. It utilizes sound waves to create detailed images of the breast tissue and is valuable in distinguishing between solid masses and fluid-filled cysts. Magnetic resonance imaging, MRI. Breast MRI may be recommended for individuals at high risk or those with dense breast tissue. It provides detailed images using magnetic fields and radio waves, offering a comprehensive view of the breast. While MRI is not a primary screening tool, it can aid in further evaluation and staging. Biopsy. When imaging detects abnormalities, a biopsy is conducted to obtain a tissue sample for pathological examination. Fine needle aspiration, FNA, core needle biopsy, or surgical biopsy may be performed, depending on the size and location of the suspicious area. Biopsy results confirm whether the tissue is cancerous and provide insights into the type and characteristics of the cancer. Genetic testing. Genetic testing may be recommended for individuals with a family history of breast cancer or those exhibiting specific risk factors. Testing can identify genetic mutations, such as BRCA1 and BRCA2, influencing the likelihood of developing breast cancer. Knowledge of genetic risk factors informs personalized prevention and screening plans. Liquid biopsy. Emerging technologies, like liquid biopsy, show promise in detecting circulating tumor DNA in the blood. While still under research, liquid biopsy holds potential for non-invasive monitoring of treatment response and detecting minimal residual disease. Treatment strategies for breast cancer. Surgery. Surgical interventions include lumpectomy, removal of the tumor and surrounding tissue, or mastectomy, removal of the entire breast. Lymph node removal may also be part of the surgical approach. Radiation therapy. High-energy beams target cancer cells and may be used post-surgery to eliminate remaining cancer cells or as a primary treatment. Chemotherapy. Systemic drug treatments, such as chemotherapy, target cancer cells throughout the body. It is often employed after surgery to reduce the risk of recurrence. Hormone therapy. Hormone receptor-positive breast cancers may be treated with hormone therapy to block or suppress the effects of estrogen and progesterone. Targeted therapy. Targeted therapies focus on specific molecules involved in cancer growth, providing a more precise and effective treatment approach. Lifestyle modifications and prevention. Breast cancer prevention involves a proactive approach that encompasses lifestyle modifications and risk reduction strategies. Implementing healthy habits and making informed choices can contribute significantly to reducing the risk of developing breast cancer. Healthy diet and physical activity. Adopting a balanced diet rich in fruits, vegetables, and whole grains, along with incorporating regular physical activity, is integral to overall well-being and may play a role in reducing breast cancer risk. A diet emphasizing nutrient-dense foods and maintaining a healthy weight through exercise contribute to hormonal balance and optimal immune function. Limiting alcohol consumption and avoiding smoking. Moderating alcohol intake and steering clear of tobacco products are paramount in breast cancer prevention. Excessive alcohol consumption has been linked to an increased risk of breast cancer, and avoiding smoking eliminates a well-established risk factor. These lifestyle choices not only benefit breast health but also contribute to overall health and well-being. Breastfeeding. For mothers, breastfeeding is associated with a reduced risk of breast cancer. The act of breastfeeding can have protective effects, possibly due to the hormonal changes it induces, and the cellular differentiation that occurs during lactation. Encouraging and supporting breastfeeding as a natural and beneficial practice contributes to overall breast health. Genetic counseling. Individuals with a family history of breast cancer, especially those with known genetic mutations like BRCA1 and BRCA2, may benefit from genetic counseling. This personalized approach involves assessing familial risk factors and, if necessary, genetic testing. Genetic counseling provides valuable information for developing targeted prevention plans, including increased surveillance, risk-reducing surgeries, and other preventive measures. Hormone replacement therapy, HRT, for postmenopausal women, considering the risks and benefits of hormone replacement therapy is crucial. Long-term use of HRT, particularly estrogen and progesterone combinations, has been associated with a slightly increased risk of breast cancer. Individualized discussions with healthcare providers help assess the appropriateness of HRT based on an individual's health profile. Regular screening and self-examinations. Regular breast cancer screenings including mammograms and clinical breast examinations, facilitate early detection. Self-examinations empower individuals to be actively involved in their breast health, enabling the identification of changes that may warrant further investigation. Early detection through routine screenings enhances the effectiveness of treatment interventions. Maintaining a healthy body weight. Obesity is a modifiable risk factor for breast cancer, particularly in postmenopausal women. Adopting a lifestyle that promotes a healthy body weight through a combination of nutritious eating and regular exercise can contribute to reducing the risk of breast cancer. Supportive care and quality of life. Psychosocial support. A breast cancer diagnosis can have profound psychosocial effects. Support groups, counseling, and mental health services are invaluable for patients and their families. Rehabilitative services. Physical therapy and rehabilitative services aid in recovery post-surgery, promoting mobility and overall well-being. Survivorship programs. Survivorship programs focus on life after cancer treatment, addressing long-term effects and promoting a healthy, fulfilling life. Your health matters. Quali.health